Good morning, students. Today's class we will see about the final year BSc Nursing examination, that is September 2015. And please make sure that I will not be dealing each and every questions in detail. Some questions I may just mention the subtopics which should be included in that particular answers, because which I might have been dealt in other videos. So please go through that. So the first question is, explain the etiology and pathophysiology of postpartum hemorrhage. Discuss the nursing management of a woman with PPH. And please make sure that here there means nursing management of a woman with PPH, not mention the type of PPH. So etiology and pathophysiology of postpartum hemorrhage, and it carries 8 mark. The etiology means the 4 T's, that is tonic uterus. That means 4 T's means ton means atonic uterus. Atonic uterus, there are so many reasons like grand multipara. All those things will come under the tonic uterus. The trauma means uterine rupture or perineal, vaginal, cervical tear. Tissue, that means retained placenta, olosuction, ureteral thrombin, that is DIC as an abruption, intrauterine fetal death, amniotic fluid embolism. All this comes to the etiology. Then comes to the nursing management. Nursing management, in that comes the detection of PPH and assess the amount of blood loss. Find out the cause of PPH. That means it may be because of torn tissue, trauma and thrombin. If you train atony, massage the uterus or give by manual compressions. Check the completeness of placenta and membranes. Examine the genital tract for any active bleeding. Monitor BP and pulse every 15 minutes. Intake output chart. Catheterize the bladder and saturation. Prepare a trolley for exploration of genital tract, that means PPH set. Send blood for complete blood profile, clotting profile. Prepare the patient for venous puncture. Set up an IV drip, that means a large bore cannula, especially in the antecubital fossa. Prepare syntocinon drip, carboprost, and crystalloid solution and plasma expander. Don't leave the client alone. Continue to massage the uterus or give bimanual compression until procedure taken over by the obstetrician. Provide psychological care, comfort to the client, give explanation before the procedure to allay any fear, because this patient is conscious and she'll be seeing so many people walking around and taking care of her. So she'll be anxious what will be the condition. The documentation in every case stop timing is critical. All events must be timed, accurately recorded. Patient vital signs, response, examination, procedure findings, intervention, decision made by the midwife or doctor. So it's very important documentation because it's a legal document also. So record intake output, timing is critical. All intake and output must be timed with accurately recorded. And record type of the fluid or blood products being infused, amount of urine output, amount of blood loss. The nursing diagnosis of these patients may be due to fluid volume deficit related to excessive vascular loss, ineffective tissue perfusion related to the vascular loss, high risk for maternal injury related to the organ, hypoxia, abnormal blood profile, fear related to threat of death, anxiety related to the outcome of disease process, knowledge deficit related to the prognosis and treatment needs. Second question is, define gestational diabetes mellitus. Discuss the maternal and neonatal effects of GDM. Explain the management of pregnant women with GDM. So definition carries 2 marks, maternal and neonatal effects carries 6 marks, and management carries 7 marks. So abnormal carbohydrate metabolism with the first onset during the pregnancy is called as gestational diabetes mellitus. Effect we have to divide in mother. It will be during pregnancy, during labor, during puerperium, and then effect on the baby. Management, it will be divided into medical, diet, and the nursing management. So diet comes also, it can be written under the medical management. So or you can write it separately as dietary management, depending upon the ppbs value of the patient. So nursing management include high risk for altered nutrition less than body requirement related to inability to ingest and utilize carbohydrate appropriately, high risk for fetal injury related to elevated maternal glucose level, changes in the circulation, high risk for maternal injury related to the changes in the diabetic control, abnormal blood profile, and tissue hypoxia. knowledge deficit regarding diabetic condition, prognosis, and treatment needs related to the lack of exposure, anxiety related to the outcome of labor, prognosis, high risk for non-compliance to the treating regimen. These are some of the nursing management of GDM. Third question is a short note. It's the physiology of normal labor. So physiology of a normal labor. So normal labor include first, second, and third. First, second, and fourth stage comes as a under the stages of normal labor. So in the first stage, uterine factors like fundal dominance, polarity, contraction and retraction, formation of upper and lower uterine segment, retraction ring, cervical dilatation, typing of cervix. Mechanical factors include formation of water, general fluid pressure, rupture of membrane, fetal access pressure. Second stage, the physiology include descent, uterine action, rupture of membrane, and soft tissue displacement. Third stage physiology include placental separation, descent of the placenta, and expulsion of the placenta. Fourth one is current trends in midwifery practice. The main trends include in case of surrogation, artificial insemination of semen or assisted reproductive techniques, adoption, acupressure, acupuncture, aromatherapy, hypnotherapy, hydrotherapy or water birth, birth bath, double skip squeeze. All these comes in the current trends in the midwifery practice. So investigations for infertility. Infertility is divided in infertility in males and females, infertility in males. So infertility in females, test for tubal patency include hysterosalpingography, laparoscopy, chromatubation, sonosalpingography, hysterosalpingography, ampullary and fibrinal salpingography. Test for ovulation include basal body temperature, examination of cervical mucus, that is Fern test, ultrasound, hormonal assays like estrogen and progesterone. Infertility in males, the semen analysis, postcoital test, sperm penetration test, semen cervical mucus contact test, urine examination, patency of vasogram, testicular biopsy, hormonal assay like follicular stimulating hormone, LH testosterone, prolactin, chromosomal study, immunological studies, and ultrasound scanning. Ethical and legal aspects of obstetrics and gynecologic practice. Many legal issues are involved in obstetrics and gynecology. Lawsuits against the nurse include the following, like problem of medication. Nurses provide medication to the client. Certain problems can occur during the medication, which result in allegation against nurses. This improper dosage of medication, improper client medication, wrong route of medication and wrong time, failure in monitoring of the client, failure to report changes in the patient to the treating obstetrician, failure in assessing the client. All this comes as the legal. The ethics in midwifery and gynecology, according to Thompson and Thompson, to professional to be ethical and to be professional. To be ethical require understanding of ethics, value, and moral reasoning and ethical decision making. The nature of ethics require one to focus on what it means to be human and how to interact with others in a respectful manner. The goal of ethical midwifery is to do the right thing for the right reason. Knowing how to make good decisions as well as why these decisions were made constitute ethical midwifery practice. Ethical principles of beneficence, non-maleficence, respect for autonomy, beneficence and respect for autonomy. In gynecological practice, beneficence based on autonomy-based clinical judgment in gynecology practice are usually in harmony. Caring. The health professionals usually care for their clients and such would always have their best interest in mind. Empowerment and advocacy. Health is a basic right to all. Some other ethical issues like conceptus issues related to IVF, cloning, surrogate mother, abortion, fetal rights versus rights of the mother, use of fetal tissue for research resuscitation, continuation of number of procedures as a child. All this comes as the ethical aspects in the midwifery practice. Care of a newborn. It divided into two: immediate newborn care and care in the postpartum unit. Immediate newborn care is include maintaining of respiration, APGAR scoring, clamping and cutting, the timing of clamping and cutting the cord, maintaining the warmth, vitamin care administration, breastfeeding, identification, assessment to find out any gross abnormality. Care in the postpartum unit, detailed physical examination, breastfeeding, maintaining the warmth, prevention of infection, cord care, eye care, and elimination needs. Obstetrical labor next is the give reasons. Obstetrical labor is a leading cause for vesicovaginal fistula. Base of the bladder and urethra, which are nipped in between presenting part and symphysis pubis, may undergo pressure necrosis. The deviate tissue becomes infected and later on may slug off, resulting in development of vesicovaginal fistula. Intravenous methotrexate is not administered during delivery in women with hypertension during pregnancy. Hypertension, there will be vasoconstriction. Methotrexate is a drug given immediately after delivery to decrease the blood loss. It acts by also vasoconstrictive effect. So if it is given the patient with hypertension, it may further elevate the blood pressure. Deep renal reflex need to be monitored in women receiving magnesium sulfate. When the serum magnesium level increases, it may lead to magnesium toxicity and it affects the respiratory center and cause respiratory arrest. The early symptom of this is absence of dependent reflex. So, deep renal reflex are observed in women receiving magnesium sulfate therapy and to detect magnesium sulfate toxicity at the earliest and to stop infusion so that respiratory destruction can be avoided. Vaginal examination is not advised in pregnant women with placenta previa. Inserting a finger into the cervical canal or applying pressure to the vaginal fornices may induce profuse hemorrhage immediately or within few hours, which may be uncontrollable. So it should be done only when all the equipments are ready for resuscitation of the patient if needed. Fundal height is routinely monitored during postnatal period. Fundal height is the clinical method to evaluate the rate of involution. The fundal height reducing 1 centimeter or 1 finger breadth per day, it indicates involution is taking place normally. It has to be checked at the same time every day. Make sure that mother passes urine and stool. Otherwise, it may give a false result. The fundal height is not decreasing. It indicates subinvolution, and this should be treated by finding the reason for subinvolution. Differentiate between first one is oligohydramnios and polyhydramnios. Polyhydramnios liquor ammonia exceeds 2000 ml. The amniotic fluid index is more than 24 centimeter. Abdomen is enlarged more than the period of gestation. Main causes include fetal structural abnormalities, multiple pregnancy, GDM, and chorioangioma of the placenta. Management is by amniocentesis. Oligohydramnios, the liquor ammonia less than 200 ml, AF by less than 5 centimeter. Size of abdomen less than period of gestation. Main causes include IUGR, postpartum pregnancy, post-term pregnancy, premature rupture of membrane, fetal chromosomal abnormality. Management is by amnioinfusion. Prostaglandin oxytocin. Prostaglandin is local application of PGE to gel is the gold standard for cervical ripening. It promotes myometrial contraction irrespective of duration of pregnancy. Main indication include induction of abortion, termination of molar pregnancy, induction of labor, cervical ripening, prior induction abortion. It can be administered orally, vaginally, or rectally. Oxytocin it promotes myometrial contractions, especially in the term uterus. Main indications include induction of abortion, augmentation of labor, and active management of third stage of labor and to stop bleeding after evacuation of uterus. It can be administered parenterally or as a nasal spray. Postpartum blues and postpartum depression. Postpartum blues is a transient state of mental illness observed 4 to 5 days after delivery and lasts for few days. Nearly 50% of the postpartum women suffer from this problem. Manifestations are depression, anxiety, tearfulness, insomnia, helplessness, and negative feelings towards the infant. No specific or metabolic or endocrine abnormalities have been detected, but lowered tryptophan level is observed. Suggests altered neurotransmitter function. Treatment is reassurance and psychological support by the family members. Postpartum depression. It is observed in 10 to 20% of mothers. It is more gradual onset over the first 4 to 6 months following delivery or abortion. Changes in the hypothalamic pituitary adrenal axis may cause, manifested by loss of energy and appetite, insomnia, social withdrawal, irritability, and even suicidal attempt. Risk of recurrence high. That is 1005 cases. In subsequent pregnancy treatment, serotonin uptake inhibitors. Amniocentesis and chaldosynthesis. Amniocentesis is a deliberate function of the amniotic sac per abdomen, preferably performed between 14 to 16 weeks in case if the root is abdominal. The main diagnostic indications for diagnosis of chromosomal genetic abnormality. Amniocentesis of two types. It's of a diagnostic and prophylactic means a treatment. Means the diagnostic is done between 14 to 16 weeks. Treatment wise, it is done in the polyhydramnios means when the amniotic fluid amount is more. Chaldosynthesis is a method in which peritoneal fluid is obtained from the calduct sac. Root is vaginal. Main indications are in suspected ectopic pregnancy and suspected case of pelvic abscess. Hydrotherapy mole and ectopic pregnancy. Hydrotherapy mole is an abnormal condition of the placenta where there is partially degenerative and partially proliferative thickness in the young chorionic villi. HCG level will be elevated. There is mainly two types, partially and complete. Main clinical features include vaginal bleeding, varying degree of abdominal pain, expulsion of grape-like vesicles per vaginally. Main treatment includes suction evacuation of the uterus and follow-up is mandatory. Ectopic pregnancy is a case in which fertilized ovum is implanted and develops outside the uterine cavity. The triad of symptoms in case of ruptured ectopic include short period of amenorrhea, vaginal bleeding, and abdominal pain. Mainly two types of ruptured and unruptured. Medical treatment in case of unruptured with methotrexate and laparotomy in case of ruptured. Thank you. Thank you for listening.